Today we're going to talk about breathing and phonation, specifically how it relates to clinical applications. So to begin, what is breathing? Breathing is the process of moving air into and out of the lungs to facilitate gas exchange with the internal environment, mostly by bringing in oxygen and flushing out carbon dioxide. What is phonation? Phonation is the process by which the vocal folds produce certain sounds through quasi-periodic vibration. Now, how does this relate to speech, language, and hearing sciences? Breathing is essential for speech. A respiration cycle during speech is 10% inspiration and 90% expiration. If we take a big inhalation before speaking, it allows for more words to come out at a time. Below is a video by Roger Love, who is a voice coach, and he's speaking to a woman, teaching her how to breathe properly when speaking. There's different ways that we can take breaths in order to have longer sentences and to be able to flow and not worry about our breath while speaking. He says that taking a huge breath through your mouth is called accessory breathing, and that's the way to have the least control of your breathing. This explains why we feel out of breath after taking an inhalation from our mouth and speaking a lot. He says it's much better to breathe through our nose because there's filters and we're able to carry longer sentences without worrying about our voice becoming raspy or not being able to breathe. We're going to talk about different clinical applications and how they help with breathing and phonation related to voice therapy. So what is voice therapy? Voice therapy is used to help patients strengthen their vocal folds and areas used for speech that could have been damaged by a certain behavior. Voice therapy includes such strategies as reducing excessive demands on the voice, adjusting pitch and volume, using diaphragmatic breathing, coordinating phonation with breathing, and developing optimal resonance. Below are different clinical applications that relate to voice therapy and how it can help with breathing and phonation.
The first clinical application which we discuss is called semi-occluded vocal tract exercises, or SOVT. These negative pressure exercises are specifically related to phonation, and they're used by speech-language pathologists in voice therapy. Simply put, SOVT means that the mouth is partially closed when making a sound. And the purpose of these exercises are to stretch and unpress the vocal folds to help them vibrate easier. This therapy is especially useful for singers and those who must speak many hours in the day, like teachers, who often have tired or strained voices. However, anyone can benefit from these exercises like you and me. How does it work? Well, when you phonate with a partially closed mouth, the pressure from your vocal folds builds up in your vocal tract, and this acoustic energy is reflected back from the lips and returns to the folds, allowing them to vibrate with less impact, less collision, less stress, and ultimately less effort. The next slide gives 3 examples of these exercises. There are different ways to practice semi-occluded vocal tract exercises. One is called a tongue trill, most commonly known as blowing raspberries. To do this move, you would stick out your tongue and blow to where it vibrates against your lower lip. Similarly, lip trills is a bilabial vibration. The video in the middle demonstrates this. Straw phonation is probably the most common example of SOVT exercises, and it is performed by vocalizing through a straw or a glass tube. The video on the right shows Dr. Titze, the father of straw phonation, performing a pitch glide. All of the exercises should be done with a gentle effort, and scientists suggest practicing it 2 to 3 minutes for 2 to 3 times a day. The next slide outlines the benefits of SOVT.
Lip trills are a bilabial occlusion, which means that your 2 lips are vibrating against each other. If you've never done a lip trill, I suggest you start by just blowing through your lips.
For those of you who talk several hours a day and your voice gets tired, here's a tip to keep you talking. You need to stretch and unpress your vocal cords or vocal folds often. To accomplish this, you can vocalize through a thin straw, like a stirring straw, several times a day for about 2 to 5 minutes. Here's a regimen you can follow. First, do a pitch glide from as low as you can to as high as you can.
As mentioned previously, SOVT exercises help to build back pressure so the vocal folds vibrate more easily. The graph on the right illustrates this interoral pressure in different positions in which the mouth is partially closed. I like to think of it as doing exercises in a pool. Your muscles are still able to stretch, but they are under less impact, therefore there is less fatigue. Doing this regularly will also help with voice alignment, which helps with coordinating register shifts. Finally, it lengthens the vocal tract, which lowers the formant frequencies. Ultimately, this helps singers sing closer to the fundamental frequency.
The second clinical application for phonation is teaching manner and voicing for patients with cleft palate. So patients who have cleft palate are able to make more nasal sounds, however, they struggle with the more high-pressure sounds such as b and p. So first, what is manner? Manner is focusing on whether a sound stops or flows continuously through the vocal folds. Some strategies to help exercise manner is to have a patient produce a sound that makes a ball of paper move in their hand, or put a tissue in front of their mouth, and when they make that sound, they can see the tissue move. So they could exercise this with sounds such as p. You can also have a therapist flick the tissue as they're making those p sounds. Another one is to have the patient continuously run their finger down their arm or their leg for the duration of the sound so that there are no stops. So why are these strategies helpful? It gives visual cues for patients to determine if they are stopping or continuing flow of air during sound production. It also helps these patients who have a cleft palate produce high-pressure sounds that otherwise may be difficult and to avoid glottal stops. Next, we will talk about voicing. What is voicing? It is focusing on whether a sound is voiced or unvoiced. Some strategies for voicing include turning the motor on, which is where a patient can put their fingers on their throat and they can feel that vibration whenever they're making those sounds. Patients can also whisper a voice sound or make a voiceless sound louder. So for example, if you're going from a voice to an unvoiced, if a patient is saying ba, 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 you can say whisper that, and they will say pa, pa, pa. So why are these strategies helpful? Patients are able to feel the vibration of their vocal folds during voice sounds, for example, when you say turn the motor on. And if patient strength is in voice sounds, they can use that strength of their voice sound and learn to turn it into a voiceless sound. And the opposite is true as well.
Clinical application number 3 is called breathing training. And breathing training is applying scientifically validated principles of training theory to the muscles of respiration. And it's very important because they are muscles and muscles must be trained. Breathing is a process that requires the coordinated contraction and relaxation of multiple muscles, so therefore they must be trained to be able to just contract and relax on its own. It also is shown that breathing training reduces anxiety, help with hypertension, angina, functional chest disorder, chronic obstructive pulmonary disease, and cardiac rehabilitation. And then exercise performance is influenced by the amount of training that these muscles receive, so therefore the more you train, the better physical outcome you will see. An example of breathing training is shown through running, where you actually use diaphragmatic breathing, which is also called belly breathing, and it involves fully engaging the stomach, abdominal muscles, and diaphragm when breathing, which means it maximizes the oxygen intake during exercise, so it allows you to gradually be able to run more and more because your body is being trained to do so. Another example of breathing training is through singing. So first, you want to breathe deeply from your lower lungs. So you can imagine a rubber ring around your waist or your diaphragm. And then you want to breathe in and try to push the ring outwards. So it's through your belly versus through your chest. And then you breathe in through your nose and out through your nose and mouth. And avoid raising your shoulders as you breathe in because you want to keep them relaxed and level. The picture to the right here shows the effect of 6 weeks of inspiratory muscle training on the breathing and whole body effort in cyclists. And it shows that the cyclists improved their cycling time trial performance by 3.8 and 4.6%, meaning that there is significant evidence that breathing training is very effective. Breathing training continued. There's 2 phases of breathing training. The first one is called foundation training, which is built on strength, power, and endurance. And these foundations provide great performance benefits, but the outcome can definitely still be improved by incorporating functional training into it. And functional training is when you use movement-specific exercise used to challenge the inspiratory muscles in both their roles as both breathing muscles and as the muscles responsible for postural control, core stabilization, and trunk rotation. And to get the most out of your breathing during these diaphragm exercises, there are 4 criteria that you want to follow and focus on, and it's the mode, the intensity, the frequency, and the duration of exercise stress. And by focusing on these 4 criteria, a person can develop a safe and effective plan to reach their personal fitness goals. And lastly, cystic fibrosis patients are known to use breathing training to help their symptoms because cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. And it affects the cells that produce mucus, sweat, and digestive juices. It causes these fluids to become thick and sticky and not be able to let things go through the tubes, ducts, and passageways to allow for normal breathing. So the way that cystic fibrosis patients use breathing training is by using active cycle breathing, which is a series of breathing techniques that help clear secretions in cystic fibrosis patients and improve airflow to the alveoli, which are the tiny air sacs in the lungs. So the first active cycle breathing technique that cystic fibrosis patients tend to use is just relaxation and breathing control, which is just normal breathing, relaxing your upper chest and shoulders and using the diaphragm muscle. And basically it's just being completely relaxed and focusing on your breath like a little bit more. The second one is thoracic expansion exercises, which is more deep breathing on inspiration and then quiet, relaxed breathing on expiration to help loosen the secretions. And then the last one is forced exhalation technique, which is when you take a couple of huffs from a medium-sized breath, and then the force of the huff cough will depend on where the mucus is felt in the lungs to mobilize those secretions. And this cycle is actually repeated until the huff becomes dry or is non-productive, or it's been 20 minutes. Therefore, breathing training is a great way to significantly help minimize the symptoms and effects of cystic fibrosis on patients.
Breathing and phonation after stroke. Decreased blood supply to the left side of the brain, where areas that control speech and language are located, can result in aphasia. Aphasia is one of the most common symptoms in stroke patients. It affects nearly 40% of all stroke patients, which is a pretty large amount, and it is known to affect a person's ability to speak. In a study I found online, it said that respiratory muscle strength of aphasic patients is significantly reduced compared to non-aphasic stroke patients, and you can assume that this is significant because a person's ability to breathe properly also affects their ability to speak properly. The patient in the case study is female with moderate, non-fluent, or Broca's aphasia and is 27 years old. The type of aphasia she has affects her ability to express language. Her comprehension of language is relatively intact. However, her repetition of words and sentences is poor. Her speech is everfull and sounds stilted, with most utterances being limited to 4 words or less. The reason that she was diagnosed with aphasia was due to a severe traumatic brain injury and stroke from a motor vehicle accident. It left her with significant difficulty speaking in sentences. The treatment plan that I've created for my patient with Broca's aphasia to help her regain some of her former speech function is 8 weeks long and involves intensive speech and language therapy, which will include breathing exercises, tongue strengthening exercises, practicing speech sounds, naming pictures, and practicing sentence formation. The purpose of the breathing exercises are to help improve the patient's respiratory muscle functions and help relieve any of the labored breathing that she may be experiencing. The speech and language therapist may have her practice deep breaths and learn to better plan breathing pauses. This will hopefully allow her to speak at greater length, since a common symptom of aphasia in stroke patients is trouble regulating breathing while speaking. The treatment plan will hopefully help her to take less breaths in the middle of sentences and be better understood by listeners.